Hello, welcome to my channel. Today on my channel, I'm going to talk about spiritual gifts, comparison of symptoms versus spiritual gifts. In spiritual framework, the behavior of indigo, crystal, and rainbow children are often viewed as high vibrational gifts that traditional psychiatrist methods may misinterpret as pathological symptoms. Comparison of symptoms versus spiritual gifts. Behaviors that appear disordered in 2026 classrooms often have distant spiritual origin according to the tradition. Schizophrenia-like symptoms, hallucination or disillusion. Clinical view. Arbitrary or vision hallucination are seen as such as childhood onset schizophrenia or psychosis. Spiritual gifts. These may be multidimensional sights or hearing. These children may be communicating with angels, spirits, or sensing energy fields that others cannot perceive. Unlike clinical psychosis, these experiences are often coherent and do not always result in social withdrawal or negative symptoms. Bipolar disorder, mood swings, grandioses. Clinical view. Rapid shift between extreme energy, mania, and deep sadness, depression are primary markers. Spiritual gifts. The warrior spirit or indigo can look like mania, while the intense empathic of crystals can look like depression when they absorb world suffering. What look like grandioses may be a soul level memory of their sufficient purpose on earth. A- ADHD clinical view, a neurodevelopmental inability to focus or sit still. Spiritual gifts, high energy children, rainbows, or those who perceive information rapidly. Indigo often become bored with linear, slow moving school curriculum. Those disturbances is often actual multitasking or scanning the room for energetic inconsistencies. Frequency of misdiagnosis. Misdiagnosis is reported to be common, especially for children who are gifted or highly sensitive. Prevalent. Researchers indicate that roughly 4 out of 10 patients with severe disorders may be misdiagnosed in certain settings. ADHD, overdiagnosis. Estimated suggest that up to 20% of children diagnosed with ADHD, nearly 1 million in the USA alone, may be misdiagnosed due to factors like age related to classrooms or overlooked giftedness. Bipolar misdiagnosis. This is a particular high in children with developmental sensitivities or intense temperamentals, where aggression or irritabilities is frequently mistaken for a mood disorder. How to distinguish between the two? Psychiatrist disorder. Symptoms often lead to a decline in friction or break from reality. Spiritual gift star child. Traits are consistent and over time and often tied to high intuition. Authority, generally difficult following rules. Spiritual gifts, specifically resistant to dishonest or unjust rules. Focus, inability to focus on most tasks. Spiritual gifts, hyper focus on topics that align with their soul mission. Social impairment, language delay common in schizophrenia. Spiritual child, social, socially selective, may prefer animals or nature over false socializing. See, in a lot of this world, it's a lot of spiritual gifts that people are misdiagnosing, and it's so many other gifts that people have, and some people have multiple ones. My last video, I told the difference in the age limit when these spiritual gifts can come in and when they can be reactivated also on the last video. I'm doing these videos because I want people to know strictly that some of these children are being put in mental institution, put on medication when there's nothing wrong with them. They just need someone to help them with the gifts that they have. And when you have parents out there who, at one point, like me, they don't understand spiritual gifts because your child is awake and you are unawoke, and you end up having a child that really needs your help, but you don't have the understanding to help. And somebody might try to intercede to help, but that also, in some cases, can put the child in danger. But this is just to bring you the information. Please always use your discernment, even with a psychiatrist or any diagnosis your child got. Because, like I said, you know your child better than anyone. Have a blessed day. Thank you.